Welcome back, everyone, to the Deep Dive. Ready for another fascinating deep dive today?
Always excited to explore these important topics.
Right, and today we're talking about something pretty crucial, especially for expecting moms, or really anyone who knows someone who is. It's peripartum cardiomyopathy.
PPCM.
Exactly, PPCM.
Yeah.
It's a heart condition that can lead to heart failure during those, late stages of pregnancy or even after giving birth.
Right.
And we're diving into a really interesting review article on this from the New England Journal of Medicine.
Oh, yeah. A great source.
So it's a big deal, right? You've just brought new life into the world, and suddenly your heart is, well, it's having trouble keeping up.
It's such a critical time. And it's a condition that really underscores the need for specialized care during pregnancy and postpartum.
Okay, so let's break this down. It affects about 1 in 2,000 births globally. But here's the thing. The rates can be, like, wildly different depending on where you are.
Yeah, geography plays a huge role, and it makes you wonder why. For instance, in Haiti, the rate jumps to 1 in 300. Oh, wow.
And in some parts of Nigeria, it's even higher, like a startling 1 in 100 births.
Wow, that's a huge difference. Here in the U.S., it's thankfully less frequent. But there's this, there's this disturbing disparity. Black women are 4 times more likely to develop PPCM than white women.
Right, and that raises all sorts of questions about healthcare access and potential biases in diagnosis and treatment. It's a real concern.
Absolutely. Okay, so you've mentioned this condition can be serious, but just how serious are we talking here?
PPCM is a leading cause of maternal death in some regions,
Wow.
with a mortality rate reaching as high as 20% in certain areas. And even when heart function recovers, many women face long-term challenges.
So the effects can really linger. It's not just a temporary blip then.
Definitely not. And to make things trickier, the symptoms often mimic typical pregnancy discomforts, like shortness of breath, fatigue, swelling, things that many women experience during pregnancy anyway.
So it's easy to kind of brush those off as just part of the whole pregnancy experience.
Exactly. And that's why awareness is so crucial, both for expecting mothers and for their healthcare providers. If something feels off, if something just doesn't seem right, it's always best to get checked out.
Absolutely. So how do doctors actually diagnose it then, if it looks like other things?
The gold standard is an echocardiogram.
Yeah.
It's basically an ultrasound for your heart, so doctors can see how well it's pumping and rule out other conditions.
Okay, so let's get into the science a little bit here. What causes PPCM?
That's the million-dollar question. We don't have a definitive answer yet. But research is pointing to some pretty interesting possibilities. It's like this big puzzle, and we're slowly putting the pieces together. One of the leading theories involves hormonal shifts during pregnancy.
Makes sense. Pregnancy is like a hormonal roller coaster.
It really is. And for some women, these fluctuations might be the culprit behind heart damage.
Okay.
Key players seem to be, well, we've got prolactin, which helps with milk production.
Right.
Oxytocin, sometimes called the love hormone, which is kind of ironic.
Yeah, the love hormone causing heart problems. Interesting.
Right. And then there's SFLT1, which is a protein made by the placenta that helps regulate blood vessels.
Okay.
So we're learning more about how those all play a role. For example, studies have shown that prolactin can actually damage heart blood vessels in mice. And as for SFLT1, it's been linked to preeclampsia,
Right.
which is a dangerous condition involving high blood pressure during pregnancy. And it seems that SSLT1 can also affect blood vessels. So that's adding another piece to the PPCM puzzle.
So hormones are definitely suspects, but what about genetics? Does that play a role?
It does. About 15% of PPCM cases involve genetic mutations
Okay.
that are also linked to dilated cardiomyopathy, where the heart's chambers get bigger and weaker.
So it's like there's this underlying vulnerability, and then pregnancy with all its hormonal changes kind of throws fuel on the fire.
Precisely. And a key gene under investigation is TTN, which provides instructions for making a protein called titin. You can think of it like a tiny little spring in your heart muscle. If the blueprint for making titin is flawed, it can really mess with your heart's pumping ability.
So it's like a crucial building block.
Yeah, absolutely.
We've got hormones, we've got genes. What else are researchers looking at?
Well, they're exploring other angles too, like autoimmunity, where the body kind of attacks itself,
Right.
inflammation, and even nutritional deficiencies, specifically selenium deficiency in certain regions. It just highlights how complex PPCM is. Like, It's not just one thing, it's this whole web of factors that we're still trying to figure out.
Really fascinating, and I'm sure we'll uncover even more as we continue this deep dive into PPCM.
Definitely, there's so much more to discuss.
Okay, so we've talked about this complex web of potential causes, but what about treatment? What can be done if someone is diagnosed with PPCM?
Well, the good news is that while there's no cure, treatment can effectively manage symptoms, help the heart recover its strength and prevent those complications. And the therapies are actually similar to those used for other heart failure conditions.
So it's about giving that heart the support it needs to bounce back.
Exactly, yeah. Medications like diuretics can help reduce fluid buildup, nitrates can help widen those blood vessels, and beta blockers, those can ease the heart's workload. It's like giving a helping hand to a tired muscle.
Okay, that's a good analogy. And what about more severe cases? Are there other options if those medications aren't enough?
Yeah, in some situations, we might need to consider more advanced therapies, like a mechanical support device called an LVAD. It's essentially a pump implanted to assist the heart.
Oh, wow.
And in the most serious cases, a heart transplant might even be necessary.
So this can be a really critical condition?
It can be, yeah.
We talked about prolactin potentially being a culprit, and there's this medication, bromocriptine, that can suppress prolactin production. Could that be a potential treatment avenue?
It's a promising area of research for sure. Early studies on bromocriptine have shown some encouraging results, and larger clinical trials are currently underway to really see if it holds up as a viable treatment option. It could be a game changer if proven effective.
That's really hopeful to hear. But this brings up another question, particularly for new moms. Does taking a medication like bromocriptine affect breastfeeding?
That's a crucial consideration, and it often leads to a difficult dilemma. You see, breastfeeding is generally safe for moms with PPCM, but the theoretical benefits of suppressing prolactin, either through medication or avoiding breastfeeding, have to be weighed against the known benefits of breastfeeding for both mother and baby.
Yeah, that's a lot to consider. It's a really personal and complex decision.
Absolutely. And it's not one size fits all. These are conversations that need to happen between a woman and her healthcare provider to really figure out the best path forward.
Speaking of tough decisions, what about future pregnancies? If someone has had PPCM, does that mean they can't have more children?
That's a big question. It must weigh heavily on those who've gone through this.
It doesn't automatically rule out future pregnancies, but it's definitely a conversation that needs to happen. Unfortunately, the recurrence rates for PPCM are pretty high, ranging from 10 to 50%. And if the condition does return, the outcomes they can be worse.
So it's not a risk to be taken lightly?
No, not at all. Counseling patients about these risks is so important. They need to really understand the odds of recurrence and how it could impact their health. It's all about finding that balance between the desire to expand their family and these very real health concerns.
So careful planning and close guidance from healthcare providers is essential. Absolutely. If a woman with a history of PPCM does decide to become pregnant again, she'll need really close monitoring by a team of specialists throughout the pregnancy and the postpartum period, just to protect her health and the baby's.
Okay, so we've talked about the immediate and potential long-term physical effects. But what about the psychological impact of PPCM? I imagine facing heart failure right after giving birth. I mean, that has to be incredibly traumatic.
You're absolutely right. The emotional toll can be profound. And not just for the woman, but for her whole family. Think about it. This is a time that's supposed to be filled with joy and bonding, and suddenly there's this terrifying health crisis to deal with.
It's a huge emotional curveball at a time that's already filled with so many adjustments and new experiences.
Exactly. And the fear of recurrence, the uncertainty about future pregnancies, the potential impact on their ability to care for their newborn, it can all be incredibly overwhelming.
It sounds like the emotional recovery can be just as challenging as the physical recovery.
It really can be, yeah. Research actually shows that a significant number of women with PPCM face mental health challenges, like depression and post-traumatic stress disorder.
Wow, that's really significant. This highlights the need for a more holistic approach to care. It's not just about treating the physical symptoms, but addressing the emotional and psychological well-being of these women.
I couldn't agree more. We really need to acknowledge and address that psychological impact and ensure that these women have access to the support and resources they need to heal, both physically and emotionally.
Absolutely. Now, we mentioned this earlier, but I want to revisit the stark racial disparity we see with PPCM. Why are Black women so disproportionately affected?
It's a really multifaceted issue, and researchers are still working to uncover all the contributing factors. We know that socioeconomic factors, like access to quality health care and those underlying health conditions, likely play a significant role.
So it's not just about biology, it's about the social and systemic factors that impact health.
Precisely.
Mm.
And then there are concerns about potential biases within the healthcare system, like symptoms in Black women might be dismissed or downplayed, leading to delayed diagnosis and treatment.
Which then leads to worse outcomes.
Exactly.
This really underscores the urgent need to address these systemic issues and ensure equitable health care for all women, regardless of race or ethnicity.
I completely agree. We need to acknowledge these disparities, advocate for equitable care, and support the research that's looking into the underlying causes and potential solutions.
It's clear that we still have a lot to learn about peripartum cardiomyopathy, but it's encouraging to know that research is actively pushing forward.
Oh, absolutely. Scientists are working constantly to develop, better ways to diagnose and treat PPCM. And ultimately, they're searching for ways to prevent it altogether.
Now, you mentioned earlier that there are some new diagnostic tools in the pipeline. Can you tell us a little bit more about those?
Yeah, for sure. So beyond echocardiograms, researchers are looking at different ways to catch PPCM earlier and with more accuracy. The idea is to kind of identify those who might be at risk or developing the condition even before symptoms show up.
Because early detection can make such a huge difference.
Huge, yeah. I mean, when we catch it early, the chances of a positive outcome, they increase dramatically.
Yeah.
One of the things being studied is high-sensitivity troponin.
Okay.
You can think of it as like a tiny alarm bell in your blood. When your heart muscle is damaged, it releases this protein. And this high-sensitivity test can pick up on even very small amounts.
So it's like a more sensitive warning system.
Exactly. And another exciting area is research on microRNAs.
Okay.
These are tiny molecules that play a big role in how our genes actually function.
Oh.
And scientists are discovering that specific microRNAs might be linked to PPCM. So by analyzing these, we might be able to identify women at risk even earlier.
It sounds like we're getting more and more sophisticated in how we detect these heart problems. I also heard that artificial intelligence is starting to play a role.
Yeah, it is. That's right. It's pretty cutting edge. Researchers are using AI to analyze electrocardiograms, or EKGs, which are basically recordings of your heart's electrical activity. And the goal is to see if AI can spot subtle patterns that could, suggest PPCM, even before any really noticeable symptoms even appear.
That's pretty incredible. It seems like technology is really revolutionizing how we approach heart health.
It really is, yeah. These new technologies hold so much promise for the future of PPCM care.
Absolutely. Now let's bring this all back to our listener. What are some key takeaways from our deep dive into peripartum cardiomyopathy?
Okay, well, I'd say the most important thing is awareness. Just knowing that this condition exists, understanding the potential symptoms, and just being vigilant about any unusual discomforts during or after pregnancy. Like we discussed, PPCM can often be mistaken for normal pregnancy symptoms.
Yeah, it's easy to just dismiss those aches and pains as just part of the process.
Exactly, yeah.
Yeah.
But if you have any concerns, don't hesitate to speak up and advocate for yourself. Getting that early diagnosis and treatment is really essential.
And we also learned that PPCM is a really multifaceted condition. There are several potential causes, from those hormonal shifts and genetic predispositions to other factors that scientists are still, they're still unraveling.
Right, and while there's no cure yet, we do have effective treatments to help manage symptoms and support that heart's recovery.
So that's good news. And maybe even more encouraging is that research is constantly progressing, offering hope for even better ways to diagnose, treat, and maybe even prevent PPCM in the future.
Yes, absolutely. Research on bromocriptine, those new biomarkers, and the use of AI are all very promising avenues.
Right.
While PPCM is a serious condition, it's not an insurmountable one. With awareness, ongoing research, and a real commitment to equitable health care, we can truly make a difference in the lives of women and families facing this challenge.
Couldn't agree more. And for our listener, if you want to learn more about peripartum cardiomyopathy, we encourage you to check out reputable sources like the American Heart Association or the Cardiomyopathy Foundation. They have so much great information available.
Those are fantastic resources.
And as you continue to explore this topic, I want to leave you with a thought-provoking question. We talked a lot about hormones and their potential role in PPCM. If they are a major driver, could things like lifestyle factors like stress management or nutrition influence a woman's risk? Food for thought as you dig deeper into this really important area of women's health.
That's a great point.
Well, thanks for joining us for this deep dive into peripartum cardiomyopathy. Until next time, stay curious, stay informed, and take care.